All right, and this morning, just want to introduce our presenters today. First, I'm going to be presenting from the department. My name is Olga Ginchin, and I'm the School Health Services Administrator for the Department of Healthcare Policy and Financing. You will hear that referred to as HCPF and also the department. Most often, you'll hear it referred to as the department. We also have Omar Estrada here from the Department of Education, and he will be presenting a little later on. From PCG, we have with us John Ward, Rose Jensen, and Lori Bobb. We also have Sarah Blumenthal from CDE and Tracy Gonzalez from the department. We'll go ahead and get started. Just a quick overview of our agenda this morning. I'm going to go over the program website, some stakeholder updates, new coordinator mentorship, review the NAME conference, and then Omar is going to take over with some info on the reimbursement spending report, the local services plan, some info on parental consent, and we will both have some important reminders and FAQs for you. Here is just a list of acronyms. So Tracy will be, and actually she already has uploaded these presentations to our website. So if there is an acronym that you're just not quite sure what that means, you're always welcome to go back and see what it means. Okay, first, my department updates. The School Health Services program website. So we have updated the program website. We have updated the program manual. I think I emailed that a couple of weeks back. We added some procedure codes. We updated all the numbers for the trend sheets that you see out there. And we've also updated those roll sheets. We have an RMTS coordinator role as well as a financial roll sheet, and those have both been updated. And we've also put some new stakeholder information out there. We have the training dates and past presentations on there. That's the section of the website that Tracy puts all of the webinars that have been recorded, and also all of those, just the slides from all of those presentations. So if there's something that you missed or something that you just want to go back and review again, and you'd rather see someone talk about it rather than just read through the program manual, that's a great place to look and review that information again. We also have the newsletters on the program website. We do, put a lot of effort into those newsletters. So if you haven't already signed up for those, I would strongly recommend that you do so. And there's a little link on there that's actually within the newsletter that you can sign up, and you can also just email Tracy. She will make sure that she gets you signed up for that. We also have annual reports out there and a whole lot more. So if you haven't bookmarked the program website, I would highly recommend you doing so, because that really is the primary source for information for the program. And we do keep it updated with the most updated information. All right, our School Health Services program stakeholders. First, just what is the stakeholder program? It is a group of individuals from across the state that participate in the program in some way. So we have a variety of roles that are represented: the RMTS coordinators, finance people, overall program coordinators. We do want a good variety of voices and representation. And they help us with idea exchange. They also help us with training. This past year, we actually had stakeholders that attended our monthly mentorship meetings. So that was a huge help. We got some really good feedback on stakeholder involvement in those monthly mentorship meetings. They also help us with information dissemination. And because they have been with the program for some time, they have a good amount of program knowledge. We have updated the stakeholder website, like I mentioned. So stakeholders are organized by region. We have their contact information out there and meeting dates. We also have what's called a stakeholder areas of knowledge grid. And what that is just all of the main areas, so main categories in the program. And all of our stakeholders have identified where they have a strong knowledge in that program area. So I think that's a really useful tool. So let's just say, for example, your district is thinking about changing the way that they claim for transportation. Maybe you claim for not only specialized and now you want to claim for only specialized. You can go out there, look at the stakeholder areas of knowledge grid and see which stakeholders claim or which districts claim for that certain type of transportation and just see how they do it. So I think that's a great tool as well. Who is your stakeholder? This is all on that stakeholder website. This, like I said, it is organized by region. We do have a couple of vacancies in the Northwest region, as well as the Southeast region. And if you're interested, if you happen to be in one of those regions where we have a vacancy, we'd highly encourage you to apply to be a stakeholder if you have any interest in that. We do have other stakeholders temporarily filling in for those regions. And we do appreciate them popping in and just and supporting those regions while we are trying to fill those vacancies. In the Northwest region, Marley Hart has agreed to temporarily support that region. And in the Southeast region, the Pikes Peak region stakeholders have agreed to temporarily support the Southeast region. And I think we do have a few stakeholders on our call today. And just looking through here to see who we've got, but we have a lot of attendees. But I see that Marley's on here, Linda is on here, Rosa, and let's see. I think that might be about it. So thanks again to all of our stakeholders. Moving on to new coordinator mentorship, I will be sending out a sign up, just might be actually later today, to all the new coordinators that have come on within the last few weeks and get them signed up for our monthly mentorship meetings. And so on those monthly mentorship meetings, like I mentioned, we do have a stakeholder representative that attends each of those meetings. We also have myself from the department. Omar usually attends from CDE. And then from PCG, we have someone who represents both the annual and the quarterly side. Like I said, those will start in September. I'll email you all out a sign up. And for the more detailed sessions that normally happen at the beginning of the year, we've actually had a change. So we are going to include those in the mid-year training. And as we get a little bit closer to mid-year training, we will communicate out those details. All right, so the NAME conference is back in person, and that will take place in Baltimore this year. So it is a really good opportunity to do networking with our own Colorado coordinators and other, not just coordinators, just those other program representatives that might, be in charge of a different facet of the program. So it's really great for networking just within the state and also across the nation. You can see how the program works across the country. And I think it's a really good opportunity to meet those people in person and really forge those connections. Does take place in Baltimore this year, and we are lucky enough to have a couple of representatives on the board that are from Colorado. We've got Shannon Huska as our Region 3 State Medicaid Agency representative, and we also have Marley Hart as the NAME secretary. And I think also it's good to note that you can often attend presentations from OIG, from CMS, so it really does give you a good comprehensive look of how the program works. Just an important reminder about billing for services. So your providers that are on your staff pool list, your direct service staff pool list, should be billing for your services. It is a contract requirement, and you should be viewing those claims in interchange. So even if you work with a billing agent, you should check interchange, make sure that those claims are going through, and make that part of your ongoing processes to monitor for program compliance, because it is a required part of the program. And that billing should be reflective of the job categories that you have on your staff pool list. And yeah, again, it is the district's responsibility to ensure that you are properly billing. A couple of other important program reminders, just we've talked about this a few times now, but make sure that your district NPI is included on all those PT, OT, and speech, language, and hearing services. Starting July 1st, those services actually still won't be denied if they don't have that NPI, but it will give you a little warning. So again, that's another really good reason to go into there and interchange and make sure that those services are going through, because there are a lot of reasons why those services might actually not show up in interchange, and want to make sure that you all are taking care of those if there are any issues. And again, just please let us know about any new staff joining the program. Anyone who is a new program coordinator, we certainly want to get them signed up for those new coordinator mentorship programs, and any other support staff, we want to make sure that they get the support that they need. And what questions do you have for me this morning? You can either use the raise your hand feature or just unmute yourself and let me know what questions you have. And again, these slides are uploaded on that program website. So, you know, you can view the information there as well. I do not see any questions for me, so I'm going to go ahead and hand it over to Omar. Thanks, Omar.
Thank you, Olga. Hello, everyone. Good morning. I'm happy to be here in front of you all virtually today. As Olga mentioned, my name's Omar. If you can't tell by the background on the shirt, I'm from CDE, the Colorado Department of Education, and I'll be your contact for all things related to reimbursement spending. So once you generate your reimbursement dollars from the billing side of the program, you will be working with me to create your 5-year spending plan known as the local services plan, and to track it annually every fiscal year through something we call the reimbursement spending report. But before I jumping into the presentation, I want to get a good feel for where you all are in terms of your knowledge for the LSP. Not a quiz, but on a scale of 1 to 5, and if you just want to put it into a chat, just a number, 1 being not familiar at all, don't know what it is, 5 being super familiar, I read it every day or close to every day. How familiar are you with your local services plan for your district or your BOCES? And if you can just put that number in a chat, that'd be great. Okay, 4.5. Okay, nice. Sweet. So far I'm seeing a big gap. Either we got a lot of experts and we have a handful of probably haven't seen the local services plan before. So if you haven't seen it before, of course, I'm going to talk about it today, but I might also recommend that you get in touch with your coordinator, or maybe someone that has that LSP on file, just to be able to see what your specific LSP for your district or BOCES look like. Because a lot of the information I'm going to provide today is just going to be general information. It's good to see the actual document for your district or your BOCES. So if we can go to the next slide, please. We're going to start off with the reimbursement spending report. So like I mentioned, the LSP is a 5-year plan. The reimbursement spending report is how we track it every year. Districts will provide their Medicaid spending information to us at CDE through an online form. We're going to get that information, compile it, analyze it, clean it up, and we return it to you all in the form of district or BOCES flyers. We also have a state level flyer, and this information is of course sent to the department as well, just for their annual reporting information. The report always opens on October 1st, and it always closes on February 28th. This year, October 1st is going to be a Saturday, and all that means it's still going to be open on Saturday. Of course, we don't expect you to jump in there on a Saturday, but that just means that you're going to get the notification the following Monday, which I believe is the 3rd, if I'm doing my math correctly. That table that you see on the screen is a screenshot from the 2022 to 2027 LSP. I'll explain a little bit what the years mean in a later slide. And that is essentially showing the main categories that we use. So those numbers on the left from 1 to 6, and these subcategories that are nested under each one of those main categories. So this is the way that we use to not only for you all to tell us how you're going to spend those dollars on the LSP, but that is also how you are going to assign the spending that you do every fiscal year on the reimbursement spending report. So it is just an easy check system. Next slide. The reimbursement spending report itself, the outline is on that screen here. So the first is just a cover page, which is just the name of your district or BOCES and contact info for your coordinator, just to make sure that we update our information on our side. And after that, you're going to have the admin expenditure report, which is the information for the team administering the program at your district or BOCES, which tends to be usually the coordinator, salary and benefits, any supplies for your Medicaid administration team, and any travel as well. So for those of you going to name as an example, if you're administering this Medicaid program, that information or that expenditure information would go in this section here as professional development. Point number 3 is the health services expenditure report. This one here is the meat and potatoes. It's where most of those dollars are going to go. And it is also where you're going to be using those main and subcategories from the previous slide to just check off what you spend dollars in. And that's going to populate a report based on the spending that you do on that slide. Right after that, we have the, hey, Olga, we have something on the screen popping up. We might just have to, just so people can see the slide. Right after that, point number 4 is the summary of expenditures. And just this is summarizing all the information that you all provided to us. We have a section for total admin expenditure, section for total health services expenditure, and also a section for total FTE that you all provided. That information is all summarized, gives you a grand total at the bottom just for you all to check the information you provided, just to make sure that we are both on the same page, sort of like a final check. And a more recent addition is point number 5 there, the annual notification acknowledgement and intent to continue participation. The first item, the annual notification acknowledgement, is tied to those parental consents and whether or not an annual notification to the parent or legal guardians that signed those forms were sent out. And the other one is just letting us know whether or not the district or BOCES that is referencing in this form is going to continue participation in the program. Both of these are going to be binary. It's either yes or no. And if you answer no or in the negative for each one of these, that's just going to trigger a response from myself just to get in touch with the district or BOCES coordinator and see if there's any follow-up that is needed or any extra support that we need to provide to you all. So no need to be worried when providing that information. Make sure to answer honestly. And for those of you that have completed this report in the past, we always update a cheat sheet that districts can use before actually jumping onto this site to fill out their information. They can use this Excel sheet that's called the reimbursement spending report cheat sheet to provide that information in the beginning and then just copy and paste it over to the form site. We update this every time we update the reimbursement spending report. So that's going to be updated every year. And we have some minor changes in formatting, formulas in the form, things that you really won't see or that are not too obvious. But what you might see is the more refined help text in question-specific support boxes. And if we go to the next slide, I can show you a little bit of what that looks like. So each question is going to have a question mark and that's encircled. And if you hover your mouse over it, it's going to pop up that context-specific box. And that's going to provide some text information as to maybe how or what sort of expenditures might go in that section, or maybe what items we might be looking for that could be helpful for us or that could be necessary to complete the report as accurately as possible. So keep an eye out for that. We're going to make sure to make those more helpful as time goes on. So let's look at some data. Next slide, please. So this information here, this is from the most recent fiscal year 2020 to 2021. And as you can see from that plus sign on the right side of the table, it's been increases across the board, which is a good sign that these dollars are going out to helping school students in your district or in your BOCES. And across the board, we're looking at 13% increase in health services, 9% increase in admin, and about a 12 to 88% split in terms of how much went to admin and how much went to health services, which is always good news. And total FTE hired at the state level at almost 910, so 909.51. So I just wanted to show you all, the kinds of things that we do with these dollars and the kind of good work that you all are doing. And if we look at the next slide, we're gonna see that split by health service category. And this is ranked by total spending, but just by the way that the dollars worked out, it's also ranked by total FTE. And what usually isn't surprising, if you've seen the figures from these kinds of report before, is the nursing and mental health are the top ones. They tend to be at the top. Nursing usually is the number one. But what is surprising is the gap between the nursing and the mental health category, and then right after that the student health category. It's almost half of it and then half of it again. That was particularly surprising, especially since this is the first data section where we used the new health service category system. So this was interesting to see this time around. And we have one more data point in the next slide. This is just something that we pulled out recently. So in the past 10 fiscal years, we were able to see almost an exact 8-fold increase for these dollars. So from 8 million fiscal year 11 to 64 million in fiscal year 21. I thought this was super interesting. So I wanted to show you all that we've seen tremendous growth in this program in terms of the reimbursement spending side. And, I'm assuming, of course, in the billing side as well. And what is also interesting is we've seen continuous growth over these years. So this is also something to be very proud of for you all doing the work in the field. Next slide, please. We're going to look at some of that support that I mentioned. I mentioned the cheat sheet, which is the very first item on there. So when you're completing the reimbursement spending report, you can start off with this reimbursement spending report cheat sheet. All of this and all the information support that I can provide is going to be available on our CDE Medicaid website. So that cheat sheet, just an Excel spreadsheet, you can put your information there and then transfer it over to the FormSite tool whenever you're ready to complete the report, just to shave off some of that extra time, to the report when you're ready. You do have 5 months to complete it from October 1st to February 28th, but this will just help to simplify the process a bit more. The second support item there is the category transition documents. For some of you that are on older LSPs, it's been around for a while, you're probably using an older list of 24 health service categories. That's the previous list that we were using before we made the transition to the 6 main 5 subcategory system. This document here was simply created to help those that are transferring that information to the new system when they complete the reimbursement spending report that's now using that same system. But if you're not on that previous list, or if you're just curious in terms of how some of these categories can be, how some of these expenditures can be categorized, you can look at this document just for some extra information. And if you are curious in terms of how expenditures can be categorized, we're working on a specific document that's going to be new coming up, hopefully on October 1st of next year, but we're going to try to get it out sooner if possible. That's going to focus more heavily on expenditure allowability. This is probably the biggest or most frequent question I receive, is whether or not X, Y, or Z item is allowable. So we're going to be looking at ways of how to think about expenditure allowability, and also list out some examples of items that were rejected in the past. So this is something that is that's coming up in the future, and just to keep an eye out for it. Next slide, please. I forgot to mention, you all can stop me or just toss in a question in the comments, or unmute if you want to, if you have a question. Anything on the reimbursement spending report before I jump into the LSP, the local services plan? Okay, no questions. So let's jump right in. The local services plan, I mentioned the reimbursement spending report is the annual fiscal year tracker of how those dollars were spent. The local services plan is that 5-year outlook of how a district or BOCES is planning to spend those dollars. So they're developed every 5 years. They always start on July 1st. They always end on June 30th. So I mentioned the 2022 to 2027 LSP template. In that case, it would mean that it would start July 1st, 2022 and June 30th, 2027. So they have some time until, they have to redo another LSP. If you don't know when your LSP is going to end, I would recommend that you find a document, get in touch with your coordinator maybe, or you can always contact me to get that information directly. I'd be more than happy to help you out. This document heavily relies on community input. This is something that you work with a community to put together to look at the health needs for students in your district. You, as a group, you analyze this information, identify and prioritize student health needs within your district, and then you put together something of a simplified budget, a plan of how those dollars are going to be spent over a 5-year period using cost reconciliation data from the billing side of the program. And once you do that, you're going to compile it together. You're going to attach a signed assurances page, which just is an overview of relevant items from the legislation covering this program. You send those 2 documents to me via email. I'll take a look at it, come back with notes, or come back with an approval if I have nothing more to add or any questions, and you will be approved. You'll be approved to have this document to help you spend those dollars and start doing some more good work. So I mentioned the most frequent question is, can I spend this money on XYZ? The second most frequent question is, can I revise my LSP? We have something that doesn't really align. So this, why we have the next slide here, if we can jump over. We have revising the LSP, which is not new. You were always able to revise the LSP within that 5-year period. 5 years is a long time. A lot of things can happen. A whole pandemic can happen. So, we could revise when needed. The new thing, though, is that second point number 2, the LSP revision companion form, which is something that we've included as of January 1st of this year. And that is just to improve the historical documentation line of these LSPs. So in the past, we would just email back and forth. We would revise the LSP and try to document the best we can with email chains and all that, but it was a little messy. So now we have this revision companion form, and that allows us to not only have better document history, but to also better support you all just to understand the history of an LSP in a district and how it changed over time. So if you would like to revise an LSP, you can start off by emailing the revised LSP, which is just making the changes you want to make, and attaching the revision companion form, which is explaining the changes that you made to the LSP as a separate form. Those 2 are going to live together. And once it's approved, once you send it to me via email, it'll take me maybe 48 hours, a lot of times less. Then the LSP that you have now, that's going to be the LSP that we're going to be working off of. And the revised LSP is just going to go along with it so we can understand the changes made over time. There are a couple considerations to keep in mind when revising the LSP, things that could slow down the process. The first one is, I mentioned the LSP is heavily involved with the community. It's a community created document. So if the revision you're making does not align with the community needs outlined in part 2 of the LSP, that's the health needs assessment, then I might ask you that you might have to go back and re-engage your community to make sure that there is alignment between the 2. And the other item is making sure if there's any other revisions needed in the LSP, just to not have to, the next couple weeks, have to revise again. Might as well get it all done in once. Take a look at the rest of the LSP, see if there's anything else that may be needed. Next slide, please. So these dollars are very flexible. And if you see me present this slide before, you know that I will say, a couple things. I've said it many times, to consider 2 things whenever you're looking at whether an expenditure is allowable. The first one being, does it align with your LSP? Does it align with your 5-year plan? And the second one is it satisfying a health need? And for these dollars, it could be spent on one student, a group of students, or all students in your districts. It's not restricted just to SPED students. So that's, part of the reason why these dollars are very flexible. I do have something new on this slide, which is just that third point, SHS program administration. That item there is put there because we have a recommendation that you shouldn't go past 20% for these dollars. Those dollars are supposed to go to the health services, remember. So if we do see some of that, we may reach out if you're not a newer district just to make sure that we can try to get a control for those admin dollars. So keep that in mind when you're doing your spending. But, with that being said, just from looking at last year's data, when you look at health service dollars, most of these dollars are going to go to FTE. About 90% in the state overall goes to FTE, 7% goes to equipment to support that FTE in most cases. And right after that, around 2% goes to PD, and the rest is assessments and, emergency funds. So these dollars are, well spoken for in some cases. They tend to be pretty quickly put to use. And let's go to the next slide. Later on in the day, we're going to talk about comprehensive reviews from PCG, and we also participate in that process to a small degree. For CDE, we will be looking at parental consent reviews. So, you'll get a sample of students for your comprehensive reviews. It's also advised just to grab those parental consents, keep those handy, because for us at CDE, around January 1st, I'll be sending you an email with some instructions of how to attach and send those over to myself for review using our secure file transfer tool here at CDE, which is where that email, that second email that you see on the screen, point number 2, that's the email that's going to be automatically sent out to the emails of districts or BOCES under comprehensive review, just with a link that'll take you to a website. If you've done it before, you won't have to create a new account. If you haven't done it before, it's a quick process to create an account, attach your documents for what you need, those parental consents, and then I'll come back and send out an approval once I've had a time to renew them. This process starts on January 1st, and it's going to end February 28th, which, if you remember, is the same date that the reimbursement spending reports are going to be due. So it's a big date to work with us. And my last point for this, I'm sure you all know these are sensitive documents, but I always want to make sure to put it out there that these parental consent forms, they should be sent via secure method. So only use that secure file transfer tool to send those over to me. So with that being said, we're going to jump over to some frequently asked questions. These are generated just depending on what kinds of questions, how often I get them in the previous year. So this year, travel was popular. So the first question is, travel for health-related training, is that an allowable expense? And I've sort of mentioned in the past when talking about name and your admin staff, yes, it is possible. You just put it under the PD for that main category that it's applicable to. In the example that I have here, I have registration fees related to travel, to conference put on by NASM as an example. So this would go under PD for your main nursing category. And just a couple considerations: make sure it aligns with your LSP. And there's also maybe any district guidelines involved with travel to make sure to take a look at those as well. So travel for health-related training is okay. I also talked about that second question: can I spend reimbursement funds on any student receiving SPED services? So like I mentioned, one, many, or all, and they don't have to be receiving SPED services. These are very flexible dollars. Just make sure they align with the LSP and there's a health need present. Next slide, please. The next question is, when would be a good time to revise a district/BOCES LSP? So we have the recommendation here to review it at least quarterly, especially if you're the coordinator, you're the one that handles the LSP most often. It's best to look at it at least quarterly because, changes happen. Maybe some things, you manage to accomplish a goal a lot sooner than you were thinking, or you're just planning to no longer spend money in transportation as an example. Then it's time to make sure it's accurate and up to date, because as soon as it's not accurate, then we have to make sure to update our documents just to make sure we have the most updated item on our side in our files for your district or BOCES. So of course, if you need to make those changes, I mentioned it's a pretty simple and quick process. Make sure to send me an email just to get that started and get that going. And how long do LSP revisions typically take? I mentioned that I can get it, the turnaround time is 48 hours. A lot of times I can do it a lot sooner than that. But there are some things, as I mentioned, that could slow things down. I mentioned it's not aligning with community input. You'll have to go back and talk to the community and make sure that, it's something that was aligned with what they mentioned as a health need for their students. And another reason may be if the change doesn't align with other parts of, of the LSP. So if you're, doing a lot of transportation related goals, but you have nursing and mental health selected and there's really no mention of that, I may go back just to make sure I understand how those dollars are being spent. So making sure that there's a good harmony between the categories and the goals and objectives and the health needs of the community, of course. That's all very important things to consider. And the more, basic one, I don't think I see this too often, is that if the responses in the companion form, if there's just a lack of detail or they're unclear, if someone that's not involved with the planning of the LSP, like the specific details, or just somebody outside of the process, if they're not able to see what is happening, then I might come back and just ask for a little more details just so we can understand what is going on. So those things can slow things down for those revisions, but for the most part, we can get those done in 24 to 48 hours. Next slide, please. And finally, I always like to put this slide out. All of our information, support documents, updated LSPs are going to be on our website. If you just type in Medicaid or School Health Services Program in the CDE search bar, we should be the first thing that comes up on the screen. And we try to update those every 6 months. We do periodic checks every so often, but we do have a big update coming up on October 1st, just when we put out the newest templates and any changes to the guidelines. We'll make sure to send emails out, of course, just to make sure you all are up to date with it. And we introduced a doodle poll that gives you all access to my calendar to put in a 30-minute session with me if you want to. So that's the doodle link that you see on the screen. Where we had it in the past just for reimbursement spending report related stuff, we're just keeping it open now. So if you want to do it that way, you can. You can also send me an email, give me a call, whatever you're most comfortable with. That includes for any questions you may have. But that is all I have. The next slide is just going to be some important dates. I covered all these in the presentation, the first three. The last one, I didn't cover the date. I don't remember if I did. The District of BOCES flyers, I'm going to send those out after the conclusion of this training, which is going to be Monday, August 15th. So keep an eye out for that. And that's actually 2022, not 2023. So any questions that you all have for me, anything I covered, I'd be more than happy to answer. I'll give a few moments before sending it back to Olga. Okay. Back to you, Olga.
All right, any questions for me that you thought of while Omar was talking? Okay, well, we have our contact information on the slides. Like I said, they are on the website. Our next session is at 9:30. That will be random moment time study. So if you've already signed up for that, you should have the meeting info. If not, you're still able to sign up for that, I believe. And yeah, so if you don't have any more questions, we will go ahead and end this session and see those of you that have signed up for RMTS at 9:30. Thanks, everyone.